With more than 60 million Americans enrolled in Medicare and more than 22 million using marketplace insurance, understanding the difference between AEP and OEP is essential. Emily Martins, a priority health expert, can help clarify how each enrollment period works and what it means for your coverage options. Thank you for being here with us, Emily.
Yeah,
appreciate it.
thank you for having me.
So let's just first a basic question. What is open enrollment?
So open enrollment is the period of time where individual coverage holders can reselect a plan, or if you are in need of coverage and you haven't been able to get it this year, you can select it. That runs from November 1st to January 15th of next year. And then there's an annual enrollment period, and that is for the Medicare folks that can select a plan during that time, change their plan, and that runs from October 15th through December 7th. So key times to choose a plan, new plan, or change.
Talk about why it's essential to enroll during open enrollment.
Well, especially now with some new restrictions that came about this past year, you have only during open enrollment to select a plan. Otherwise, you would need a special enrollment event, which would require proof, like a loss of coverage from an employer. So if you've gone without coverage for a while and you're outside of like a 60-day window of that special enrollment of having a baby or getting married or something like that where you miss that opportunity, now would be the time. Or perhaps those that have been stuck in a plan, maybe that wasn't suiting their needs. So now would be the time to evaluate that.
How do people know which health plan to choose? How do they go about that?
There's a few different ways. You can shop yourself. I personally recommend working with someone, whether you call the insurance carrier directly. We have an internal team at Priority Health that can help. We also work with independent agents as well as other carriers doing that. And I think that that's a really good option. They can shop plans for you. They can make sure that your doctors are in network, and there's a lot going on this annual and open enrollment period, so it's a really good time to connect with somebody that's an expert in this field. They're very well versed. They do this every single day.
How can people, though, prepare for their plan selection? What can they be doing?
A really good thing would be to make a list of all the doctors that you or your family members see and your medications. So those are going to be two key things. Also considering what you have to have done in the next year. If you have an upcoming procedure perhaps, or something that you've been putting off, and make sure that you speak either with an agent, or if you're shopping, that you're looking at those find a doctor tools, and then looking to make sure that those doctors are in the network, that your medications are covered, how they're covered, or do they have a copay? Do they have a percentage that you're going to pay? Is there a deductible? Those kinds of things. It's going to be really important and to make sure that you're keeping those costs down.
Any particular questions people should be asking themselves throughout this process?
Yeah, I would say, what are you looking for? Are you looking for really good coverage? Do you want to know that you can go to any specialist, let's say, in the state? Or is price the only thing that really matters, maybe because you're healthier? Are you looking, with our Medicare lines, we have some, extras like over-the-counter benefits, things like that, and kind of finding a balance on what you're looking for in terms of healthcare costs, keeping those down, and those extras if those are available. Again, another reason to talk to one of our internal folks or an agent that can kind of help you look at those options and what's available to you.
What are the most asked questions that you hear during open enrollment?
Probably a lot about dental, like what dental benefits are offered with certain plans, what your cost sharing, basically, like how much am I going to pay when I go to the primary care physician? We have something that came in this year with some new regulations. All of the bronze level products on the individual market space are actually HSA eligible. So we've been getting a lot of questions about that. So that's kind of a nice feature. You're able to contribute to an HSA plan next year and still have coverage when you go to the doctor and just pay a copay. So that's a new thing. Those are some big questions that I've been fielding, and just basically like how much am I going to pay out of pocket for A, B, or C? Especially for families, it's really key to know. They don't want to know or think that they're going to go to the doctor or go to, let's say, an emergency room and have a huge bill. They want to know like what that cost containment is, and I think that's what's driving those questions and kind of makes people a little bit nervous sometimes.
Yeah, for sure. Emily, your best advice for someone maybe who hasn't even started yet this process, or
Get in early, yeah. So if you're trying to work with somebody, I would say now's the time to reach out. And if you're not, I would start your shopping now because you have a lot to educate yourself on. You want to look at the plans now. A lot of folks wait until the week after Thanksgiving to get this process started, and I would be one of those if I were in their shoes as well. I'm a procrastinator, but it's not the time to do that today. This year is busier and just more interesting, and there's a lot more involved this year than ever. So agents and our internal teams and just all the information out there, now's the time to start because everyone's going to want to be speaking with people.
Okay.
Yeah.
Thank you so much. Very helpful, Emily. Appreciate you.
Thanks, Amber.